हेलो मेरे YouTube फ्रेंड्स, कैसे हो सब कोई। आशा करती हूँ कि आप सब बहुत अच्छे होंगे। तो दोस्तों, एक बार फिर से मैंने आपके लिए एक वीडियो लेकर के आई हूँ और ये है पेप्टिक अल्सर डिजीज़। ओके, सो वी आर गोइंग टू सी अबाउट पेप्टिक अल्सर डिजीज़ एंड यहाँ पे हम लोग देखेंगे पेप्टिक अल्सर होता क्या है, पेप्टिक अल्सर के साइन एंड सिम्टम्स देखेंगे, ठीक है, जिसे हम क्लिनिकल मैनिफेस्टेशन बोलते हैं। उसके बाद में उनका डायग्नोस्टिक एंड असेसमेंट देखेंगे एंड फिर ट्रीटमेंट देखेंगे, ठीक है। तो ये सारा चीज़ इस वीडियो पे हम लोग देखने वाले हैं। बिना लेट किए हम लोग वीडियो को जल्दी से देंगे। और दोस्तों, वीडियो को प्लीज़ एंड तक देखिएगा, तब जाके आप लोगों को समझ में आएगा कि पेप्टिक अल्सर होता क्या है और इसका हम लोग कैसे टेक केयर करेंगे, ठीक है। चलिए वीडियो को शुरू करते हैं। So we will see over here, a peptic ulcer may be referred to as gastric, duodenal, esophageal ulcer, depend on its location. So when a person is getting peptic ulcer, it can be happen like the person may be getting it in gastric area, or the person is getting in a duodenal area, or the person is getting in an esophageal area. Okay, so different area, that means depending on its location, different area a person is getting the ulcer, that is known as peptic ulcer. Okay, sometimes the person can get in a gastric area, so it is called as a gastric ulcer. Sometimes it can be a duodenal area, so it is called as a duodenal ulcer, and sometimes it can be your esophageal area, so it is called as an esophageal ulcer. So these are the things which will happen in a peptic ulcer. So it is referred to as a gastric ulcer or a duodenal ulcer or a esophageal ulcer. Peptic ulcer is an excavation that forms in the mucosal wall of the stomach, in the pylorus or in the esophagus. So what we are seeing over here, they are telling like peptic ulcer is an excavation. Excavation is nothing but hollowed out area, okay, and that particular excavation is taking place in the mucosal area of the stomach. So you can see in the picture, okay, how the excavations are taking place, okay, in the stomach wall and in the pylorus. Pylorus is nothing but the opening between the stomach and the duodenum. So you can see the area, okay, that area is you can see in the picture, that area is shown. Okay, so what they are saying over here, the opening between the stomach and the duodenum, and the duodenum. Okay, so that is called as your pylorus. Okay, you can see in the picture, or in the esophageal area, esophageal in the topmost area. Okay, you can see the word esophagus is written over there. So peptic ulcer take place in these all area. Okay, so it's like that. So erosions are taking place in the mucosal membrane, okay, and erosion sometime it can be very deep in the muscle layer and sometime in the peritoneum area also. So we can see in the picture how it is shown over there. Okay, so muscle layers are there, okay, so mucosal area is also there. So you can see how the erosions are taking place, okay, and that erosions sometimes it is so deep that it can go to the muscle layer, okay, so it can reach to the submucosal area and it can reach to the muscle area also, and simultaneously it will be reaching to the peritoneal area. So yeah, ये ऐसा है। तो जब भी पेप्टिक अल्सर किसी को होता है तो जो स्टमक एरिया होता है वहाँ पे इरोशंस हो जाते हैं, ठीक है, घाव टाइप का हो जाता है, और वो घाव बहुत ज़्यादा डीप रहता है, जैसे कि आपका मसल लेयर को भी वो अफेक्ट करता है। इतना ज़्यादा डीप हो जाता है वो घाव की, वो मसल लेयर को पार कर करके आपका पेरिटोनियम एरिया में भी पहुँच जाता है। Here we are seeing that peptic ulcer, it is more likely to occur in the duodenum area than in the stomach area. Okay, and plus they say here like it occurs alone, the ulcer is occurring alone, and sometimes it may occur multiple also. Okay, they are focusing more over your gastric, that is like chronic gastric ulcer tend to occur in the lesser curvature of the stomach. So there is a curvature area where sometimes it will be occurring. We can't say that often it will occur in that particular area, very less time it can occur in the curvature of the stomach. Then after that they are telling over here like near the pylorus. So most of the time the ulcer formations are taking place in the pylorus area. Okay, and here they are telling compares the features of gastric and duodenal ulcer. So it's like that. Sometimes the ulcer may occur in a cluster form, or sometimes it will be occurring like a alone area. It can occur, but different area it will be occurring. And like most of the time we see like esophageal ulcer is also there, and that happens because of the backflow of HCl from the stomach into the esophagus. Okay, so we can call it as a gastroesophageal reflux disease. Short form is GERD. So what we have seen over here is like that पेप्टिक अल्सर जिसे भी होता है वो स्पेशली उसका डिओडिनम को ज़्यादा अफेक्ट करता है दैन द स्टमक, ठीक है। और जो अल्सर है वो अकेला ही फॉर्म होता है, और कभी कभी मल्टीपल्स अल्सर फॉर्म हो जाते हैं, और ख़ास करके जब किसी को क्रॉनिक गैस्ट्रिक अल्सर होता है तब जो है वो आपका लेसर चांस रहता है कर्वेचर ऑफ द स्टमक में फॉर्म होने का। ज़्यादातर जो अल्सर होती है वो पायलोरिस में फॉर्म होती है, ठीक है। और यहाँ पे किसी को भी अगर ईसोफेजियल में अल्सर है तो वो कारण होता है बैकफ्लो ऑफ HCl जो हमारे स्टमक पे रहता है, अगर वो उल्टा फ्लो होने लगेगा तो उसका ईसोफेजियल एरिया को वो वहाँ पे अल्सर फॉर्म कर देगा, जिसे हम कहते हैं गैस्ट्रोएसोफेजियल रिफ्लक्स। ये भी एक बीमारी है, ठीक है, जिसके कारण से ईसोफेजियल अल्सर होने का ज़्यादा चांसेस होता है।
So we are going to see here that occur with the greatest frequency in people between 40 and 60 years of age. Okay, so we can see like most of the people, those who are in 40 years of age and 60 years of age, they can get peptic ulcer. Apart from that, a woman who is childbearing age and children as well as infants, they are also observed for peptic ulcer. And women, those who have faced menopausal period, they have the incidence of peptic ulcer equal to the men. Okay, and peptic ulcer in the body of the stomach can occur without excess acid secretion. So overall what we have seen, यहाँ पे हम लोग देखा है लाइक पेप्टिक अल्सर ज़्यादातर 40 से 60 इयर्स ऑफ एज के लोगों को होता है, ख़ास करके ये वुमेन ऑफ चाइल्ड बेयरिंग एज जिसको है उनको भी होता है, और साथ ही साथ ये देखा गया है कि बच्चों में भी पाया गया है, साथ ही साथ छोटे बच्चों में भी पाया गया है पेप्टिक अल्सर। और जो वुमेन को मेनोपॉज हो चुका है उनको पेप्टिक अल्सर होने का ज़्यादा चांसेस रहता है इक्वल टू मेन। और पेप्टिक अल्सर खास करके स्टमक एरिया पे होता है जहाँ पे विदाउट एक्सेस एसिड सेक्रेशन टेक प्लेस होता है। In the past, we have seen that stress and anxiety were thought as that the person are getting peptic ulcer because of that. But in research, they found out that peptic ulcer was not happening because of stress and anxiety. There was an infection that is called as gram-negative bacteria H. pylori. That particular bacteria was causing peptic ulcer. It is not known why H. pylori infection does not cause peptic ulcer in all people, but most likely the predisposition to ulcer formation depend on certain factors such as the type of H. as yet unknown. So nobody know why H. pylori infection does not cause ulcer in other people. It's very rare. Only some people are getting because of H. pylori. They are getting peptic ulcer, and some people they are not getting peptic ulcer. Okay, and sometimes the factors are unknown. Nobody know what type of factor because of that the person is getting peptic ulcer. We can't assure 100% that the person can get because of H. pylori peptic ulcer. It's not like that. We can't give assurance like that because there are certain kind of unknown factors. Because of that also what is happening, persons are getting peptic ulcer. So we are going to see certain points over here. So what they are telling over here is like excessive secretion of HCl in the stomach may contribute to formation of peptic ulcer. So when the HCl level is high in the stomach, because of that what happens, peptic ulcer formations take place. And sometimes because of stress also peptic ulcer formations take place. Okay, because stress is increasing the secretion of HCl in the stomach. Okay, then second point they are telling over here, the ingestion of milk and caffeinated beverages, smoking, and alcohol also can increase this peptic ulcer. So the person should not injection of milk. Okay, they should not take much milk, and sometimes they should not take caffeinated beverages also, and they should avoid smoking, and as well as they should avoid alcohol. So these are some of the things which will, because of that, HCl secretions are getting more and the person can get peptic ulcer. Peptic ulcers are found in rare cases in patients with tumors that cause secretion of excessive amount of hormones gastrin. Okay, so it is a very rare case. Okay, it's not like the person, those who are having tumor, can get peptic ulcer. It's not like that. It is very rare. Okay, it is very rare that the person is getting peptic ulcer. Why it is happening? Because that time what happens, excessive secretions are taking place, okay, of the hormone gastrin. Okay, so because of that this peptic ulcers are taking place, but it is a very rare case. We can't say that it is like that. Next they are telling over here is the ZES nothing but Zollinger-Ellison syndrome, consists of severe peptic ulcer, and that happens because of extreme gastric hyperacidity and gastrin secretion, benign or malignant tumor of pancreas A. So these all things are there about the peptic ulcer. Overall we should understand, because of high level of HCl production is taking place in the stomach, because of that only what is happening, peptic ulcer is taking place. So we are going to see now about the clinical manifestation. In clinical manifestation there are few points which we are going to focus on that. They are saying like symptoms of ulcer may last for few days, weeks, months, and sometimes it will disappear only to reappear, and often without any identifiable causes. So it is like that, the symptoms will be there for few days, few weeks, and or sometimes for a month. Next point they are telling over here like many people with ulcer have no symptoms. 20% of people will be having perforation and hemorrhages, and 30% of the people they will be having like no preceding manifestation will be there. Third point we are going to see here like, as a rule, okay, the patient with an ulcer complain of dull groin pain or a burning sensation in the mid-epigastrium or the back. Okay, so sometimes the person will be complaining of dull pain. Okay, sometimes they will be complaining of a groin pain, or sometimes they will be having a burning sensation, okay, in the mid-epigastrium, or sometimes they will be having a pain in the back. So the clinical manifestation. Further they are telling here like, it is believed that the pain occur when the increased acid content of the stomach and duodenum erode the lesions and stimulate the nerve ending. So they are trying to say us about the pain, why the pain is occurring and how the pain is occurring. Okay, just because of the acid content, okay, it is increasing in the stomach. Because of that what is happening, the duodenum is getting eroded. Okay, erode of the lesions will be taking place, and simultaneously what will happen, that particular thing will stimulate the expose of the nerve ending, and because of that person will be having pain in the abdomen area, or you can say in the stomach area they'll be having a pain, or in the groin area they'll be having a pain. Apart from that they are telling over here like, another lesion, another theory they are telling here suggested that content of the lesion with acid stimulated or local reflex mechanism that initiates contractions of the adjacent smooth muscle. Okay, so it's like that. There is another theory they are suggesting that contract of the lesions with acid stimulates the local reflexes. Okay, that will be happening, and there is a mechanism that indicates a contraction of the adjacent smooth muscles will be there. The next point they are telling over here, pain is usually revealed by eating. Okay, so when the person is eating anything, that time only the pain will be there, because food neutralize the acid. Okay, when the food is reaching there, it is neutralizing the acid, or by taking alkaline. However, once the stomach has emptied or the alkaline effect has decreased, the pain return. Okay, it's like that. So whenever the stomach is empty, simultaneously what will happen, the pain will be getting returned. Next point we are seeing over here, sharply localized tenderness will be there. Okay, can be elected when the person is like applying pressure, gentle pressure on the epigastrium area. That time what will be there, there will be tenderness. Okay, and sometimes it can be towards the right side, okay, of the midline. There also they can feel the tenderness. So these are some of the clinical manifestations we have seen till now. Other symptoms we are going to see over here, they are, so first one is your heartburn, that is pyrosis, then second is vomiting, then third is constipation or diarrhea will be there, and bleeding will be. So these are some of the other symptoms which we can see a person, those who are having peptic ulcer. We are going to see now about the assessment and diagnostic finding. So here in this we are going to see certain points. First one is your physical examination, second one is barium study, third one is endoscopy, then fourth one is stool, and fifth one is gastric secretory studies. So in the first one they are telling over here, physical examination. In physical examination, when we are doing for peptic ulcer patient, that time we they care about pain, epigastric tenderness, and your abdominal distension. These all things will be there while doing physical examination. We will come to know. Barium study is done for upper GI tract, that is nothing but gastrointestinal tract, may show an ulcer. To see the ulcer, they are going to do the barium study. And endoscopic examination also is done. Okay, with this what we can see is visualization or inflammation changes, okay, inside the stomach. What is happening about that we can see, about the ulcer condition we can see, about the lesion conditions we can see, and yeah, these all things we can see, and about the size and the location also we can see with the help of endoscopy. Next is stool. In that we can focus about the negative for occult blood. Okay, sometimes the blood will be there in the stool, so to check that they are going to do the diagnostic finding about it. And then gastric secretory study. So these are some of the assessment finding about peptic ulcer. Now we are going to see about the management. In management we are going to focus on certain points. So first one they are telling over here, like once the diagnosis is established, the patient is informed that the condition can be controlled. Okay, so once the person came to know that he or she is having peptic ulcer, then the doctors say them that the things will be getting under control. Okay, so how it will be under control, because with the help of certain medications and the lifestyle change, because of that we can under control the peptic ulcer. Sometimes it happens when we are treating peptic ulcer, it can come back again. Once one time treating is not happens, like a person is getting cured by the peptic ulcer, but the lifestyle, if they're not maintaining the eating pattern, then once again the peptic ulcer can come back. So here what they're trying to say is, like peptic ulcer treated with the antibiotic to eradicate H. pylori. Okay, so they are having peptic ulcer, they will be getting antibiotic dose to eradicate the infection of H. pylori. Okay, and yeah, and then they are telling here the main goal is to eradicate H. pylori and to manage the gas. Management is very important, because if the HCl inside the gastric is inside the abdomen or inside the stomach is not proper, then ultimately the person will be getting peptic ulcer. That's the reason the main focus, or you can say the main goal, is H. pylori. That is one of the bacteria. Because of that we have seen that the person are getting peptic ulcer, and we need to manage the gastric acid. If the gastric acid getting managed in the stomach, then what will happen, the person will not get peptic ulcer. We need to more focus on methods, okay, such as medication, lifestyle changes, and surgical intervention. That is very important. These are some of the management which we have seen. So lifestyle management we are going to see over here. In lifestyle management we are going to focus on first three things, that is stress reducing and rest. Then we are going to see about smoking, and then we are going to see about dietary pattern. That is very important, that we need to focus on this dietary management and all. So we are going to begin with stress reduction and rest. So how we are going to do that stress reduction and rest? Okay, that is very important. In our day-to-day life we need to take lot of rest. We should not take lot of stress. When we take stress, our body, okay, that will start excreting more HCl, and because of that what will happen, the peptic ulcer will be taking place in the stomach. So we need to avoid that. Okay, we need to change our lifestyle. The stressful lifestyle we need to change, and exhausting lifestyle we need to change. We need to relax a lot. We need to take regular medication to change all this stuffs. Going to see about smoking cessation. That is very important. Should decrease the secretion of bicarbonate from the pancreas into the duodenum. Because of that, the increased acidity of the duodenum is taking place. That's the reason the person should not smoke. Whoever is smoking, they are having more chances of getting peptic ulcer, just because, as I have already told, bicarbonate from the pancreas into the duodenum. Okay, that secretion is getting, because of that what is happening, acidity is getting increased in the duodenum, and we know that the person will be getting peptic ulcer. So the person, whoever is smoking, they need to stop doing that. The next point we are going to focus on dietary modification. In dietary modification, so whoever is having peptic ulcer, what they need to do, they need to avoid certain kind of food, like extreme temperature of food they should not eat. They have to avoid that. They should avoid consumption of meat extracts, like extraction, they should avoid that. Then like alcohol, they have to avoid it. They should not drink much alcohol. They should avoid taking coffee. Okay, and they should avoid taking certain caffeinated beverages and diet rich in milk and cream. These all things they have to avoid taking it. If the person want to eat something, they should eat like a proper neutralized food. Okay, like in a day they can take 3 times of meal. Okay, and like a small and frequent meal they can take. Person should take a food which they can tolerate, and they have to avoid taking food which cause pain. So they have to take a lot of care about their dietary pattern. Whenever they are taking any food, they have to just focus on food which will not cause pain to them. That type of food they have to eat, and they have to avoid taking and they can take food which is like tolerated one, which they can tolerate, which they can digest. So those kind of food they can take. So now what we are going to see, that is nothing but follow-up care. Follow-up care is very important, because sometimes it happens, a person, those who are having peptic ulcer, now they are getting treatment, they think that it will be getting subside, but it's not like that. Again the recurrent will occur. Okay, again the chances of peptic ulcer is there. Once more the person can get the peptic ulcer. So they have to take care a lot about themselves. Okay, they need to see what food they are eating. It should be a proper food. They need to eat a proper food. And then if the person is having any kind of tachycardia, hypotension, or if they are having a GI bleeding, and from the stool, in the stool also they can see that their bleeding is there. So that particular time they have to come back to the hospital, and they have to do the follow-up care. That is very important. They should not avoid it. So friends, I hope you all have understood about the peptic ulcer. पेप्टिक अल्सर आपको आप सभी को समझ में आ गया होगा क्या है. एंड किसी को भी अगर पेप्टिक अल्सर का ऐसे साइन एंड सिम्टम्स दिखता है तो कृपया करके अपने नज़दीकी हॉस्पिटल्स पे चले जाएं और या जा करके अपना इलाज करवाएं. और दोस्तों, ये वीडियो को ज़्यादा से ज़्यादा शेयर करें ताकि दूसरों को भी समझ में आए पेप्टिक अल्सर के बारे में. और दोस्तों, जो लोग मेरे चैनल पे नए हो, कृपया करके मेरे चैनल को सब्सक्राइब कर लीजिए ताकि आपको ऐसे ही नए नए वीडियोस मेरे एजुकेशन के मिलते रहें. मिलते हैं नेक्स्ट वीडियो में. टिल देन, बाय बाय, टेक केयर, बी सेफ, थैंक यू.